I've actually, as I said earlier, I haven't had any patients, jump off the table, but I've actually had a patient jump on the table because they would come in for x-rays routinely and got so used to it. And we made it such a positive experience. They would come in that x-ray suite and that dog jumped on that table because they knew it was going to be such a rewarding experience in the end.
Hey, everybody. Thanks so much for tuning in again. We've got a great episode for you featuring 3 great speakers. I'm so excited to welcome Carolyn Spivak back on the show, along with Dr. Dennis Keith and Antonia Lauteris. And we're going to talk about something that's becoming kind of a bigger and bigger topic of conversation and something that's really important when it comes to our own personal safety and the well-being of our patients, and that is hands-free radiography. If you've ever walked away from a radiology session feeling like you just wrestled a bear, this episode may hit home a little bit. I mean, hands-free radiography isn't just about reducing radiation exposure. It's about making the whole process smoother, safer, way less stressful for everyone involved, especially our patients. And better positioning, less patient movement, and clearer image, all of those factors together just creates a win all around. I really enjoyed the conversation with this panel and the opportunity to dig into what makes this approach so beneficial. We discussed how reducing radiation exposure protects staff, why anxiolytics and sedation lead to safer, calmer patients, and how better positioning improves diagnostic accuracy. Plus, of course, we get into the practical side of integrating hands-free techniques into a busy workflow because, of course, in a fast-paced clinic environment, efficiency has to be a key consideration as well. Let me go ahead and introduce you to our speakers, and we'll jump in.
Carolyn has been in the veterinary industry for over 25 years. She received her Bachelor of Science in Animal and Poultry Science from Virginia Tech, her Associate of Applied Science in Veterinary Technology from the Community College of Baltimore County, and her Master's in Applied Science in Patient Safety and Healthcare Quality from Johns Hopkins. Over her career, she has held roles in patient care, leadership, hospital management, and field support positions. She's currently the Senior Director of Patient Care Associates in VCA's U.S. Medical Operations Department. Carolyn's passion is helping to create opportunities for continued growth in skills, knowledge, and leadership development for our veterinary technicians and assistants, with a special focus on patient safety and healthcare quality.
Antonia Lauteris, the Director of Veterinary Technologist Learning and Development for VCA Canada, began her career as an RVT in Ontario in 2006 after graduating with honors from Georgian College. Throughout her career, she gained experience in primary care practice and emergency and referral medicine while being employed in departments such as the ER, ICU, and surgery. In 2014, Antonia successfully completed accreditation as a veterinary technician specialist with the Academy of Veterinary Technicians in Anesthesia and Analgesia. Following relocation to Vancouver and joining the team at the Vancouver Animal Emergency and Referral Center as head technologist, Antonia began to provide on-site training and associate development, in addition to lecturing at various conferences such as the BCVTA Fall Symposium, Canada Veterinary Virtual Symposium, and regional VCA Canada conferences. Antonia is also a published author and proponent for hands-free radiology. She's written articles for various publications and is an affiliate and trainer with the Hands-Free X-Ray Initiative. And last but not least, Dr. Dennis Keith. He is a graduate of the University of Arizona and Colorado State University. After time in private practice, he completed his radiology residency at the University of Pennsylvania. He then spent a year on faculty teaching small animal abdominal radiology during core rotations, studying CT, and formulating scan protocols for the implementation of a new scanner at the university, as well as managing a busy clinical caseload. He served as the medical director of VCA Animal Referral and Emergency Center of Arizona until 2017, where he included radioiodine therapy as an important part of his clinical practice. He's spoken internationally on the topics of diagnostic imaging in emergencies, clinical CT, and 3D imaging techniques. In 2017, Dr. Keith was asked to take on more responsibility and is now the VCA Regional Medical Director for Arizona, Utah, New Mexico, Nevada, and San Diego region of California. This was such a great panel. They really brought great ideas along with practical applications. Let's go ahead and get into it.
Looking to protect your canine patients against parasites? Look no further than Simparica Trio, Serolaner Moxidectin and Pyrantel chewable tablets. The first chewable to offer triple protection from heartworm disease, ticks and fleas, and roundworms and hookworms. It's also FDA approved to block infections that may cause Lyme disease by killing deer ticks.
Use with caution in dogs with a history of seizures. Serolaner belongs to the isoxazoline class, which has been associated with neurologic adverse reactions. The most common side effects were vomiting and diarrhea.
Visit SimparicaTrioDVM.com for full prescribing information.
All right, well, thank you everyone who's tuning in. We are recording at VMX. Well, I'm at VMX. We're recording virtually, the wonders of technology here. And I'm joined by Carolyn Spivak, Dr. Dennis Keith, and Antonio Lauteris, and we're going to talk about kind of hands-free radiography and radiation safety. So thank you to all of you for joining me this morning.
Thanks for having us.
Thank you for having us.
So let's just kind of jump right into it. Why is hands-free radiography important?
Well, I'm going to jump in on this one. I think the skills that we teach and the skills that the technicians employ when doing hands-free, they minimize the chance that the patient has, those inadvertent injuries, the pulls and strains when having x-rays made. They are really going to be attentive to the patient's temperament and stress levels. So for low stress handling and the fear-free approaches, I think it's just better for the patient. We have all known technicians that have thrown their back out or hit their head on the collimator in a scary, violent manner. So I think it's a lot safer for the techs, even outside of radiology. The technicians exercise a lot more anatomic knowledge and a much more intentional approach to make better positioned radiographs so we get better diagnoses. By the way, it reduces everybody's radiation exposure as well. And I think the only reason we haven't done it prior to this is people like Antonia and Carolyn hadn't developed the techniques, and now they have, and they put that work in. So the question I would ask for anyone listening out there is, in 2025, why would we ask our technicians to do something that carries more risk to their own personal health and safety? And why would we ask people to do things in ways not consistent with low stress or fear-free handling? I just think this endeavor is so important, and I think we need to get the word out.
Absolutely. And if I could just to Dr. Keith's point, when we look at our human counterparts, right? If you go to the ER and you have to get an x-ray, or you even go to the dentist, nobody in human medicine is ever going to be close to that primary beam. They don't even hold babies for x-rays. They have devices to help keep the babies in place. And so when we want to elevate what we're doing as credentialed or registered veterinary technicians, technologists, elevate our role, elevate our, how people recognize us and be closer to our human counterparts, I think this is a natural progression, and we need to be advocating for our own health and safety. We're no different than human technicians and that work next to x-ray machines. We don't have additional layers of protection to keep us safe from that radiation. So why are we allowing to be treated differently when we're in the radiology suite? And I think as technicians, we always want to be advocating for our patients. And like Dr. Keith said, this greatly aligns with low stress handling, and it's the patient safety is top priority. And as a technologist, if I see a painful patient that I'm going to have to restrain them and hold a broken leg down without pain control on board, and this is something I have to see day in, day out, this is where burnout comes from. This is where compassion fatigue comes from. And that is a greater, broader issue within our industry. However, this is something we can do to help combat that just by following these low stress handling techniques and being able to advocate for sedation and pain control for our patients in the radiology suite.
Yeah, and just to kind of add to that too, there's so many good points that were already mentioned, but I think too, it's like our patients don't understand. Half of them don't like to walk on slippy floors in our homes, much less be up on a table. And so if we can take this compassionate care approach, and it has nothing to do with, pets not being good, quote unquote. It's odd to be up on a table like that. And so to ask them to do something that's kind of counterintuitive, and then if we're holding them, it can be a stressful situation, like Antonia and Dr. Keith mentioned. And so by using some of these techniques and having different positioning devices help to replace our hands, we can still provide calm and comfort to them, which is what's key, but also get diagnostic images in hopefully one or two tries instead of continuously having to repeat those attempts because they move, or there's some kind of thing that happens that then all of a sudden it's like, well, that wasn't diagnostic, so let's get them back up on the table and try again.
Man, if anybody wasn't sold like 5 minutes ago, I feel like they are now because so many good points were made here. And I love that you bring up the low stress handling. We've had that conversation a lot throughout a lot of the recordings that we've done here at VMX this year because it is so important. And, Tony, to your point, yes, like burnout absolutely comes from those patients that don't even want to walk in the door, and or those owners who say, "Oh, my pet is scared of you. My pet hates being here. My pet doesn't like you." It's like, oh, just like daggers to your heart. And so, yeah, I think all of you have made this beautiful case for the benefit to veterinary professionals in terms of physical safety as well as emotional well-being, and of course, low stress handling to our patient. And we're getting more diagnostic views because even if we do the best we can and we know maybe that x-ray isn't really as diagnostic as we would like it to be because our patient maybe wasn't sedated, we didn't get great positioning. We can explain that to owners, but they don't always understand. So let's just take that question mark out of it.
Absolutely. And I have to say, as a technician that has been in the industry for almost 2 decades, I'm not sure I would have had longevity in this career had it not been for hands-free radiography. I've been doing this for quite a long time, and I worked as a surgery technician for many, many years. And I physically don't think I would have been able to maintain longevity within my role had it not been for these techniques.
And I think that's a great point too, right? Like when I went to tech school, I've been doing it for the same length of time, like over 20 years, and we weren't taught that way. And so now, it's like now that we're learning new techniques, it's different. Like I don't try and oversimplify the fact that it's a different approach. And a lot of people are like, you default to what you know, but that's not how we were trained so long ago. And even recently in some of the schools, we're not trained to do it. It's with manual restraint. So to Tony's point, it helps with longevity too, because we know better now, we can do better, and hopefully that'll help with career longevity and just like overall satisfaction within what we do on a daily basis.
Yeah, it sounds like just even this small change can just has this ripple effect throughout so many different parts of our jobs. I want to jump into radiation safety. Dr. Keith, I feel like you might be a good person to ask about this. I remember when I first started working at the University of Florida College of Veterinary Medicine more years ago than I will say on this podcast. They had us watch this video of the effects of radiation over time. And I still vividly remember some of the images from that video because it's this silent, yeah, I don't know, can be this silent killer over time. Really, we can get some pretty profound effects if we're not careful. So I'm wondering if you can talk a little bit about the importance of radiation safety, the effects that radiation over time can have, and ways that we might become exposed that we may not even be thinking about.
So, starting kind of at the end of that question, there's a lot of sources for radiation, and there's sort of three big buckets. There is a background radiation for each area that you live in. People that live high in the mountains of Chile or something probably get a lot more background radiation because there's less atmosphere protecting them. For us, there's a background in your city, but you also can get some exposure when you fly. Believe it or not, every banana you eat has radiation in
I
it
love
because
bananas.
Yeah. So you do get exposed, but then there's another bucket, which is that when you start to get to higher levels, we do worry about things like cancer risk and that type of thing. And you may need to have imaging done of yourself, right? So there's medical exposure. There is when you need to go to the dentist or when you need to have a CAT scan, or God forbid you've had an accident or something and they have to do some assessments on you. So that is something you don't have a lot of control over, and you trust your doctors to sort of help make judgments on which images are worth making. And then there's what we call occupational exposure, and that's where we have potentially a lot of control. That's one we can really reduce. And so one thing on the reduction side that I want technicians to hear is there's the guiding principle is called the inverse square law. And so for every time you double the distance from the table, you square that, so you get 4 times less exposure. So as you move away from the table, your exposure drops rapidly. And that would include all the areas that are not covered by lead, right? So as you move back from the table, your entire whole body exposure becomes much, much lower. So if you do the math, even moving back 3 feet or 36 inches, if you square 36, you get over 1,000 times reduction in the amount of radiation you would take in. So it's really important. This whole thing about being able just to move back from the table and preferably out of the room, because if you can get 6 or 8 feet, your exposure should become extremely low. If you can't get a wall in between, I do still recommend you wear the personal protective gear. But like the distance is the biggest thing. Like that's the one thing that we struggled to sort of master. And again, the great work of people like Carolyn and Tony. And to be honest, there is a whole host of regional technician directors that are all working to develop these techniques. Because one of the things I think that techs do find rewarding about this is it makes each case a little bit more of a challenge, because you've probably never restrained a leg exactly like that one, or you've never quite applied this technique to that type of shoulder. And so the technicians really get to start to develop these skills and then employ them for the safe and comfortable restraint of our patients in such a variety. So I think there's an engagement side of it too. It kind of takes making x-rays and makes them not rote anymore. Like you're going to use a lot of anatomical knowledge to make sure you get the positioning right, but also how do I make this most comfortable for my patient? So it just totally refocuses it. And then it creates so much, such a level of safety for the technician, because they can move away from the table and hopefully out of the room.
Absolutely. Carolyn and Tony, I would love to hear your input on that as far as, increasing safety for yourselves and then being able to really start to perfect those techniques and focus not so much on, can I hold this animal down while I get this, the best view that I can, but can I really get this great diagnostic x-ray?
And I just have one quick note, and then Tony is masterful at this. I've seen her in action, and she is like a true ninja with everything, like just making sure that the patients are comfortable. But I do want to highlight the point like that we're always taught never to leave a hand off of a patient, and so it is very like most of the conversations I've had with veterinary technicians or assistants, it's like, but I never take my hand off my patient. So it's hard to take that step back. And it's a matter of gaining that confidence, because I think that's key. It's obviously we want our patients safe. We don't want any injuries or anything like that. But I've always been trained, like taught to never let my hand off my patient no matter what. And so to take that step back is difficult at first. And I think that's where giving yourself some grace to go, okay, that one step back, that another, when you think of the span of 3 feet, it's not that far, but it feels far when you're not touching your patient. And so doing that in a stepwise progression, realizing they're okay, you can get to them if you need to, but then you're reducing the exposure to yourself more and more as you step further back. I just think that's like a keynote that not that I didn't understand, but when we're like, yeah, no, you can do this, that was one of the biggest resistances I had was that I'm not supposed to take my hand off the patient. And I love them. I love, all, people that take care of patients. Like that is a definite thing that you want to keep top of mind. But yeah, just to give yourself grace. I'll let Tony, I know you've done a ton with this, so I'll turn it to you.
No, I couldn't agree more, especially when you're learning, right? It's all about mitigating that risk. We do this in everything we do inside the hospital and outside in our personal lives. And so when you're learning, it's really important to remember the principles of ALARA. So as low as reasonably achievable. And the 3 pillars of that are going to be time, distance, and shield. You can do things like if you do have to be in that room, as Dr. Keith mentioned, distance yourself from that patient, but also rotate radiology duties. Maybe I stay in the room with my PPE on and a meter back from that patient if I can this time, and then the other technician goes the next time, and maybe hey, even the doctor goes in the third time, so that it's not going to be everybody that's going to be in the room all the time. Distancing yourself from that patient and wearing your shielding. And when you are backing away from that patient, especially while you're learning, as Carolyn said, you take these baby steps back. I almost say, you're not just you're securing them on the table, of course, and you're making sure they're nice and still, but you're not just going to turn around and walk out the room. You kind of just moonwalk back away from the patient a little bit and just slowly assess them. And as you get more comfortable, you can increase that distance while they're secured on that table. And securing them on that table, as Dr. Key said, like we are as technicians and technologists so good at MacGyvering things all the time. We are constantly finding solutions and making things work. And so you do get to be creative. You do have the steps for certain positions, let's say in orthopedic studies, that you're going to follow 1, 2, 3, 4, but every patient is a little bit different. And so I kind of say, get them in that position that you want them to be in. And if I had this foam spray or something that I could just like around the patient and keep them in suspended animation and then crack them out of it and out they go, that would be the easiest thing. But obviously we don't have something like that, and that would be a little bit terrifying for the patients. But what the point is, that get them in that position for that perfect diagnostic x-ray and then build around them. Get creative with a towel or a foam wedge or some tape or some straps, whatever you have to do to keep them safe and secure and nice and comfortable, because we see dogs and cats lay in the most abnormal or awkward positions all the time. Their heads are down off a bed and they're upside down. They're comfortable. So as long as we keep them comfortable and secure and build around them into that position that we want, with maintaining that level of comfort while advocating for any analgesia that might be indicated for that particular case, we're going to find much more success with those x-rays. They're going to be secure on that table, and we can moonwalk out of that room a lot easier and increase that distance even more and more every time. And it is a gradual thing. There may be some cases that are going to be more difficult to stay out of that room, but being in that room and next to that patient should be the rarity. And while, it sometimes for some clinics, 100% hands-free can be a bit daunting, let's get as close to that as we can. And I'm going to do a little shameless plug up here in VCA Canada that we have so many hospitals that are 100% hands-free. And now we're seeing success of all the x-rays that we're taking, about 85% of them are being taken hands-free. So I promise you it can be done, but it is like learning any skill. It's going to take some time and some practice. All you technicians out there, that as soon as you started learning putting in catheters, that tape went all over the place. Everything was sticking to itself, but you practiced, and the muscle memory came to the fingertips, came to the hands. And as you did it more and more, you became more proficient. And I promise these skills are just like taping in a catheter. 1, 2, 3, 4, steps 1, 2, 3, 4. You're going to practice, and then all of a sudden you're going to be able to do it with your eyes closed.
I just want to chime in to build on that a little bit. Like that, you see the technicians when it starts to click and they really get excited about doing it. I just want to peel out there to clinic owners and people. The one way you can kind of shoot this down is not to give them the equipment they need, because in the precise wedges, a combination of tape and straps and things for each patient is going to be so different that one important key to success is empowering your technicians to have the tools they need to do this at the moment they're making the images. So, Tony, I don't know if you could speak a little bit to what you think are the most key tools that you use.
Absolutely. Well, V-troughs are going to be essential for not only your thoracic and abdominal studies, and every hospital has them, but I use them all the time for orthopedic studies as well. Simple Velcro straps and Velcro around the table, soft Velcro that's quick release, are going to be essential for helping to restrain any of your thoracic or pelvic limbs, maintaining those limbs in position for not only abdominal or thoracic studies, but orthopedic studies. Foam wedges that are radiolucent are key for keeping those joints close to the table, but keeping them nice and comfortable and maintaining that straight position. And a lot of people don't realize that you can actually take an x-ray through a thin towel that doesn't have a lot of embroidery or any design on it. And I've coined a term, and we all know that we like to burrito cats and small dogs when we're restraining them. Well, sticking with the delicious theme of Mexican food, I call it the kitty quesadilla or the little dog quesadilla. And it's just using a flat towel on a table, folding it over the patient so they're in that towel, and you can anchor that towel down. So keep them in a nice lateral position for a chest and abdominal study, or towels to help prop up limbs or keep the patient's head nice and straight if they're in sternal position and you need to get an x-ray, or in dorsal position, you're keeping their head nice and comfortable. But for me, it's going to be your troughs, your foam wedges, your straps, whether those are ties or straps, but anything that's going to be not traumatic to the patient and is going to be quick release, because you want to make sure that they're not anchored down just in case they do move. Of all the years I've been hands-free, knock on wood, I have not had a patient ever jump off the table or injure themselves secondary to these restraint devices, because you're keeping them nice and comfortable. These sandbags that we use are also essential. They're not those vinyl sandbags that are really good for propping doors open, and that's about it. They're nice and soft, they're not completely full, and you can really mold them around the patient. So those are going to be your top restraint devices that are key to success. And Dr. Keith, I'm so glad that you brought that up, because without the proper equipment, we just are not going to be able to get the job done. And for those orthopedic studies, I will say pain control and sedation is that other tool in the toolkit that is going to be essential for those patients. Because if we're going to be asking them to maintain a painful limb in a position that we need to obtain that diagnostic study, it's just not fair to them to have that done without pain control and often just a mild sedation, just to take the edge off. It's not a heavy sedation or a full anesthetic most of the time. It's just a little something, something to take the edge off, to make sure that they're not going to be in a really painful state when they're extending that limb for that orthopedic study.
Absolutely. Absolutely. I think that's all great advice. And I want to kind of continue down that road as far as tips for implementing this effectively. Tony, I thought that was a great summary. Dr. Keith, I'm so glad you brought that up, of making sure that, if we're going to be asking people to take x-rays in this way, that we're providing the right equipment, we're making that easier to do. Let's talk about workflow for a moment, because we talk about procedural sedation more and more as we're talking about low stress handling. And of course, one of that knee jerk kind of reaction is like, oh, but now I have to like build sedation into my workflow, and do I have time, and do I have appropriate staffing and things along those lines. Personally, I think as we get better at this and kind of get into a groove, it actually tends to make things a little bit more efficient. But there is kind of that initial like, oh gosh, how is this going to impact my workflow?
For sure. I think the skills are easy to learn. It's that workflow, that change, because we all don't like change. But you know what we're really good at in the industry is change, because we don't practice medicine the same way we did 10, 20 years ago. And so it does take the adoption of this as a culture shift and looking at new ways to function as a team in that hospital. It will take a little more time at the beginning. You're learning a new skill, and that's just something that the team has to accept. But as you become more proficient with these techniques, you know what? I can replace often another person by using my restraint devices. So we're talking about being short staffed, or we're talking about workflow. If I can take those x-rays on my own because I have restraint devices, I free up another individual to go out and do something different in the hospital and get another task done. I might need help like repositioning or lifting a big patient, but most of the time I can absolutely get those x-rays on my own if I do have the right mild sedation or the right restraint devices and the skills to do it. So it'll be a little bit awkward at first. The techniques are easy, but it does take that hospital to have that mentality to shift that culture. And I often will say we do have these tools in the toolkit for these patients that we have to prepare to sedate. Because if a hospital has, let's say a blocked cat come in or a laceration repair, we're always going to plan, stabilize if we need to, and sedate when we have the appropriate staffing and ability to do so to get the procedure done. It's not like we hold that cat down or that light laceration repair down and we do those things without sedation or pain control. That would never be the case. All we have to really do is shift diagnostic imaging into those same buckets to prepare and plan for the patient's best interest.
I just want to say to the doctors out there that we have to get out of the mindset that it's a convenience procedure, right? Like the idea that we're going to make the x-rays while they wait and in a half-hour appointment, that we just have to drop that and leave that as a historical thing. I think that it's really important to let owners know that this is a procedure and that we need to prepare. My saying to the interns I teach is sedation is indicated. It's just not always necessary. So it's appropriate to have that conversation in the room that if we need to, here's what we need to do. Now, sometimes it's obvious, right? And we need pain control and whatnot on board. But even for wellness images or something like that, it's appropriate to talk to the owners. And then, if it's a cat and an additional trip to the veterinarian would be overly stressful, fine, maybe we can do them that afternoon, but let's not set the expectation that it's a while you wait procedure. So let's have the cat stay with us for a little while so that the staff can find that time where we have the appropriate number of people doing the appropriate number of things, that it's the right time to make those images. For dogs, dogs oftentimes don't mind a ride in the car, right? So I think asking ourselves, is it important to have these done today, or is it appropriate to have the dog visit on a day where maybe we're more appropriately staffed to knock out the wellness x-rays, right? So I think getting out of the mindset that this is a convenience procedure, and just even if it's just taking that moment, that split second to think about when is the right time to make the images for this patient, when we have the flexibility to do so. Clearly in trauma assessments and things, you're going to have less flexibility in that. But what I find is my ER clinics are the ones that are the most receptive to hands-free, because it tends to leverage people, right? Like we don't have a person playing the part of a sandbag. We just use a sandbag for it. So like the truth is, I think that ER doctors are they don't see it as a convenience. They see it as an emergency. So they're receptive to it. Whereas I think sometimes we get ourselves in a mindset that it would be really convenient if we did these right now in the moment, and yet we don't think about all the other aspects. So if we can switch that mindset, I think the workflow becomes a lot easier to accept.
And I do think, and to both of your points, and now so many pets, I know my girl had loved her anti-anxiety medicine before she would come to the clinic. So a lot of pets already have something on board now, especially, just when we're thinking about compassionate care. But it really is a conversation for the entire hospital team. The front desk needs to understand why we're talking about hands-free, why we might have to do some sedation, why we might have to schedule things differently. Again, you have advocates all across your hospital teams. And so by having those conversations, and even, we had some of the hospitals took a moment to have this introduced as part of as a hospital meeting. And so everyone got to kind of talk about, like, how would this impact this area that I work in, or, from the doctors and the technicians and the assistants, like what kind of workflow questions might we have, or what resources or what education do we need? And then it's much more of a team sport. And I think I've learned, I'm not good at the front desk. Like, I have so much respect for CSRs and all the questions they get and all the things, but they also, it's almost like the catcher on a baseball team. They see everything, right? Like they're watching all of the movement, and they're really good at seeing the overall hospital workflow. So having them be part of the conversation as well. Like, how can we educate clients? How can we make sure that we're, if there's questions, that they feel comfortable having resources to be able to answer those kind of things. So I just think, again, like, this is a change in culture. It's not something just to do, and it doesn't happen overnight for sure. But I think having those tools, having the right education, and just really having respect of the hospital team to have the conversation that we all play a part in this, I think that just really helps with implementation. Even if it takes time, it's still something that's like, when a new person comes in, we still talk about it and we explain why this is important, or why this approach might be different.
I'm getting the impression too that, as we implement this into our workflow, those initial points that maybe we expect are going to be pain points in terms of time and resources and things like that, probably actually we end up creating a lot more efficiency than we might think initially. And I'm kind of laughing to myself here at Dr. Key, thinking about what you were saying about not having this be a convenience procedure, because I mean, speaking for myself here, I hope I'm not alone, where, it seems like such a good idea at the time. Yeah, we'll just get these x-rays real quick. And it never, well, I shouldn't say never, but almost never quite goes that way. It generally ends up being this like monkey wrench in your schedule, and it puts everything behind. And it seems like it would be this convenient thing to do these x-rays while we're waiting, but really it sets the whole day back. Even some of these more urgent cases, I'm thinking of, the vomiting dog or cat where we want to rule out a foreign body or something like that. Unless those animals are decompensating in front of our eyes, it's probably not going to change the game too much if we take that x-ray right that minute, or if we take it in 2 hours from now when we have a little bit more of an opening. What I'm hearing a lot of is a lot of mindset change in areas that we think it's going to slow us down, where we think it's going to be more inconvenient. Really, we're probably doing a lot for workflow and really speeding things up. I also wanted to just go back and clarify real quick. It sounds like, listening to all three of you, that certainly sedation needs to be a consideration when we're doing hands-free radiography, but it may not need to be the case every single time. Is that right?
Absolutely. I think we have to always approach each patient differently and address their needs on that case by case basis, tailor those needs. A calm approach can go a very far way. I say to anyone I'm training out there, we really have to think about that patient first. And I will say with the caveat that there should be no expedited procedure or speed or time saver that is more valuable than anybody's health and safety. So I think advocating and empowering your team is important, because just like you cannot say to somebody they cannot choose to wear sunscreen and go outside, or they can't wear their seatbelt in the car, I feel that our safety is so important that there should be no time crunch that is really going to outweigh that safety. But when, keeping a calm approach with those patients, particularly for the really good dogs or the well-behaved cats, it's all about their well-being and their frame of mind. And they're scared, they're sick, they're in an environment that is unfamiliar to them. If you can walk in that x-ray room with them, take a deep breath, leave your excitement or stress at the door, and really bond with your patient in that radiology suite and make it about them, and use a calm approach and make it a less scary experience by just bringing your energy to them and focusing on them, you can go so far with hands-free radiology without even having sedation on board. I will say for most orthopedic studies, we're x-raying something because it's painful. So pain control and sedation is probably going to be indicated, but you can go so far with a calm approach, even some of your PVPs, and then, reaching for those sedation or pain control tools when you can. And I mean, you guys can feel free to edit this out or what, if you'd like to, but as an anesthesia tech, I like to say, for the veterinary industry, drugs are like hugs for your insides, right? Like, I think as just an anesthesia tech, I think all of our patients should have something while in hospital to keep them nice and calm and comfortable.
I have to agree. I'll jump in there and say, I also think when it does come to PVPs as well as sedation in hospital for procedures and things like that, the more you do it, the easier it becomes. The more you see it, the more comfortable you become with the drug protocols and the effects that they're going to have. And it becomes a lot easier to say, yeah, let's just go ahead and sedate, because for the most part, we're really fortunate now to have a lot of safe drug options for sedation, things that are quick, where we can get our patients back on their feet and out the door very effectively, very quickly. But it does take doing it and using the drugs, seeing the effects, and doing procedural sedation, pain control, whatever's indicated for that patient, to really develop that comfort level.
And I think it's important too to have the conversation if you're not comfortable, empowering the team to be like, I'm not sure about this, or to your point, like what the intended side effects might be. This is another moment where it's really important that the technician and the assistant speak to the doctor really openly to say, like, this is our patient. Let's focus on comfort, but also if there's something that I'm concerned about, or, that I have any hesitation on, that we're talking about that beforehand. Because to your point, like if I'm stressed, if I'm nervous, it is absolutely going to transfer that energy to the pet. And so we want to make sure we're all on board. We kind of have like a plan in place. And I just think it makes it go so much more seamlessly for everyone. But again, I just want to just emphasize that conversation is so critical to be able to have that freedom to talk to your doctor about things that, you might have hesitation on or concerns about. And people can be nervous about sedation. I'm sure you've seen it, Tony, a lot, where they're like, what are you doing? What's supposed to be happening right now? And
Absolutely. And I have recently encountered too that some RVTs, especially when they're new, they're actually nervous to tell the DVM that maybe the sedation wasn't enough because they feel like it's overstepping their role. And that was a bit of a, after doing this for so long, that was truly a light bulb moment for me because I had never thought of that perspective just because I've been doing this for so long and I have no issues with asking for some more if my patient requires it. However, with those new technicians, they're afraid. And I said, let's reframe this. Let's actually look at this like that clinician has made a call on this protocol based on their physical exam findings. But if you've given them some pain control or some sedation and you're still having issues manipulating a limb with that on board, that is actually a clinical finding that is going to help your clinician with their overall diagnosis or the clinical picture. So don't think that you're going and telling them that they've done something wrong. Go and give them a piece of clinical information that is going to help them in the end. And then they can tailor that protocol even further. And maybe even the next time have some more understanding of what doses might be need for the next patient they encounter with a similar presentation. So I think reframing that for a lot of new technicians who are afraid to even mention that to the doctors is essential for when you're onboarding this to the hospital, especially with new team members.
yeah, just being that patient advocate, right? They can't speak for themselves. So telling the doctor the situation's changed and this is something else they need. I mean, those should be just really open, safe conversations to be able to have. But it takes time when you, especially when you're new, but just to empower them to have those conversations.
I think when we start to have this conversation, some doctors start to see the barrier of cost to the client for this additional sedation and or pain management. So as a radiologist, I want to bring in just a little bit representing for my profession, right? So a little bit of frustration in that we always seem to think about, well, now I have to sedate all my patients. But the truth is, about half in my experience of patients, especially if they're sick or debilitated, they don't really need sedation. The techniques that we've developed, a lot of times those pets can be restrained, especially if they're a little bit debilitated, and we get the images we need. So there's a large segment of our population. Then we have the segment that are coming in for orthopedic x-rays or something that is painful. And it really bothers me when we try to make those before we have appropriate pain medication on board. And when we really address sedation and pain meds for those guys, that should be done whether we're doing it manually or with hands-free techniques. So then we can take that big swath of patients off and say, look, they would have needed it either way. And we start to get to this smaller and smaller fraction of patients that actually get sedation because we want to do them hands-free. They tend to be puppies that are feeling great but need something done, right? And they just want to leap off the table. When we talk about patients that maybe are a little more stressed and have become in a situation they may fear bite, or maybe they've even become a little bit fractious, we'd sedate them anyway. So like it's funny to me that sometimes the doctors feel like there's this obstacle there, but when you actually have really skilled technicians who are excited to do this, it turns out the difference in the patients that need sedation versus not is actually really small. I would predict it's less than 10%. And the other 90% either would have needed sedation either way, or you'll probably find your techs could learn to do that segment without. So I really don't think this should be a barrier. I do think there's a learning process. I'm hoping either Carolyn or Tony can jump in on this one. There's a learning process. So there is a point at which you probably will increase the number of sedations to give your techs the time to really get these techniques under their fingers, right? In a moment, they have to be able to apply any one of these techniques. So there's a learning curve, and I think giving them sedated animals to perfect these techniques will pay off in the long run. But yes, there's a little bit of an introductory learning curve for the staff.
You're absolutely right. We see that all the time within the data that we collect at first, that many more patients are getting sedation because it's a new technique and the technicians are require it. But the amount of patients that require sedation definitely decreases as proficiency increases. So we actually do see that in the reporting that we have with this. And you're so right, Dr. Keith. As a technician, I do not want to manhandle any patient to put an IV catheter in or collect blood from or to do a grooming procedure on. We all know the ramifications of having an overly stressed patient for any of those procedures. And a really scared or stressed patient today might come back as an aggressive patient tomorrow. So we have to think about the longevity for our patients' welfare as well. If that we can make this a more pleasant experience today, they're going to come in less fearful tomorrow. And that I think is so in line with compassionate care. I will say, doing hands-free, if you can really desensitize them to the radiology suite, make it a positive environment to go into. I've actually, as I said earlier, I haven't had any patients, jump off the table, but I've actually had a patient jump on the table because they would come in for x-rays routinely and got so used to it, and we made it such a positive experience. They would come in that x-ray suite and that dog jumped on that table because they knew it was going to be such a rewarding experience in the end. And that's that mind shift that we really have to encourage within our teams when we're shifting the culture towards hands-free.
That'll make you want to get up and go to work in the morning for sure.
Right?
My patient's just going to go and jump right on the table.
Right? It was awesome.
I love it. I love it. Well, this has been such a great discussion. I think it's a hugely important topic. And all of you have done such a wonderful job of illustrating the importance from multiple different angles. Employee well-being, better diagnostic imaging, low stress handling. We're just better for the patients in general. There's so many reasons. If you can't hear it in my voice, I'm very much a believer that this is the way to go. I think probably this discussion has made a lot more believers out there. So I want to say a huge thank you to all of you for joining me, and I hope we can continue this conversation and really continue to see the benefits that this can provide.
And thank you so much for the opportunity.
Yeah, thank you so much. If you can't tell, I can talk about this.
I know. Yes, and I am really excited about it too. So I'm forcing myself here to go, okay, we're not gonna, spend the entire day talking about it.
We really appreciate the opportunity. Again, it just takes some education and awareness and shared stories to really help move this forward. So we really appreciate it.
It was so great to sit down with Carolyn, Dr. Keith, and Antonia. I want to say a big thank you to them for joining me. Also, thank you to VCA for making this episode possible. And of course, thank you to every single one of you who tuned in to listen. If you enjoyed this episode, please leave us a 5-star review wherever you get your podcast to help other veterinary professionals like you find this and other great content we try to put out there. For more episodes, you can click on the Education tab on the VetFolio website or find us wherever you get your podcasts. We're always eager to hear your thoughts and ideas for future episodes, so if you have one, feel free to reach out to me at dvm@vetfolio.com. We can connect on Facebook at Dr. Cassie DVM, or you can follow me on Instagram at dr.cassie.dvm. And remember, if one animal is better off because of you today, it's a great day.